135. Which of the following test procedure cannot be performed on specimens collected by skin puncher? The answers here is bilirubin, calcium, T3, T4, blood cultures. The answer is blood cultures. 136. Which of the following test procedure cannot be performed on specimens collected by skin puncher? All the answer here is bilirubin, calcium, T3, T4, ESR. The answer is ESR, because we know ESR, you need a lot of blood. 137, it reads the same. So, which of the following test procedure cannot be performed on specimen collected by skin puncher? So really all of the answers, the correct answers would be blood culture, ESR, APTT. 138. Which of the following information should not be provided to the patient by the phlebotomist? And the answer is what the test is for. You never ask them you never tell them what the test is for. Let them talk to the doctor. 139. Which of the following laboratory professionals has the greatest public relations responsibility for the laboratory? Phlebotomist. 140. A phlebotomist enters a patient's room at 5:30 a.m. while the patient is asleep. The phlebotomist should gentulate the patient and proceed. 141. A phlebotomist is about to collect a blood specimen from a patient in ICU, but the patient is unconscious. The phlebotomist should proceed as though the patient were conscious. 142. Which of the following personnel has priority with the patient? The answer is physician talking to a patient. So the answers here was phlebotomist with a stat request, physician talking to a patient, nurse giving the patient a bed bath, respiratory therapy. And it says physician talking to a patient, but I thought it was phlebotomist with a stat request. Maybe I have the wrong answer. Let me see. 142. Is B. Wow. Physician talking to a patient is priority. Okay. I guess it would be. 143. Which of the following personnel has priority with the patient? And the answer is clergyman administering communion. 144. If a patient is not in his or her room, how should the phlebotomist locate the patient? Ask the nurse's station. 145. If a patient's family is in the patient's room when the phlebotomist enters, the phlebotomist should ask the family to step outside the room. 146. How many steps are involved in proper patient identification? 2. 147. What is the first step in proper patient identification? The patient is asked to state his or her name. 148. What is the most important step in patient identification? Compare the medical record number on the requisition with the patient's wristband. 149. Which of the following information should never be the same on any two patients? The answer is medical record number. 150. If a patient's wristband matches the requisition entirely except for the medical record number, the phlebotomist should contact the nurse's station. 151. If a phlebotomist identification bracelet is on his or her nightstand and it matches the requisition exactly, the phlebotomist should ask a nurse to affix the wristband on the patient. 152. What infection control equipment should a phlebotomist use when performing a skin puncture procedure? The answer is sharps, biohazard bag, gown, and gloves. (153) What equipment does a phlebotomist need for the site preparation prior to a skin puncture? Heel warmer, alcohol, and sterile gauze. I guess this would make sense because the rest of the answer would be heel warmer, iodine, and sterile gauze. And the next one was lancet, sharps, and gloves. The next one was gown, glove, sharp, and biohazard bag. So I guess it's A. 154. Heel warmer should heat within which of the following temperature ranges? 39 to 42 degrees Celsius. 155. What is the maximum length lancet that may be safely used for skin puncture on an infant's foot? 2.4 mm. So I guess you could say mm is maximum, like maximum have 2m, and 2, it's usually 2 and you just double since it's maximum. 2.4. 156. Which of the following describes the best site to select for skin puncture on an infant's foot? Lateral portion of the plantar surface of the heel. So I guess you call plantar where you plant your feet, right? Where you put your foot down. So the lateral side. 157. Which of the following site is acceptable to use for skin puncture on an infant foot? It's just like the top question. Oh, the top was the best site. This is an acceptable site. And the answer is the great toe. I don't know what the great toe is. I guess the great toe is the big toe. 158. Which of the following describes the best site to select for skin puncture using a patient's finger? The answer is distal phalanx of the middle finger. So it would be distal phalanx of the middle finger or distal phalanx of the ring finger or middle finger and palmar surface. Or no, middle finger, palmar surface. Okay, 161. Skin punctures performed on patients' fingers should be made perpendicular to the fingerprint. 162. If a heel warmer is applied to a skin puncture site, this will increase blood flow to the site. 163. By how much can blood flow to a skin puncture site be increased if a warmer is applied prior to a skin puncture? 7 times. 7 times more. Okay, 164. What portion of the capillary circulation is increased when a warmer is applied to a skin puncture site? Arterial. So that's the oxygen that carries the blood, so it's more red blood cell. Okay. 165. At least how long should a warmer be applied to a skin puncture site prior to making a skin puncture? So it's not asking how long, it's the at least, which means no less than 3 minutes. At least 3 minutes. Okay, 166. Which of the following tests requires that the site be warm prior to skin puncture? Capillary blood gas. So not glucose, but blood gas. That's why more oxygen come when you warm it. 7 times more, right? Okay. 167. Which of the following action may result in a QNS skin puncture specimen? Insufficient puncture. 168. What is the rationale for the order of draw for the collection of multiple specimens following skin puncture? Or what is the rationale for the order of draw? It minimized platelet clumping. 169. The following tests were to be collected from a patient following skin puncture: platelet count, bilirubin, T3. In what order should these tests be collected? Platelet count, bilirubin, T3. (170) The following microtainers were to be collected following skin puncture: lavender, pink, red SST. In what order should the microcontainers be collected? Lavender, because that's CBC, complete blood count. So lavender first, and then pink is, the blood bank. For comparison, something like that. And the red SST, that's a serum separator. So a serum separator is always last, I think. I don't remember. Anyway, it should be lavender, pink, and it's not really serum separator is not really last, but a red serum separator is last. So lavender, because remember lavender come before pink, and then the red serum separator. So serum separator should really be the last order of draw if there's a serum separator. Okay, 171. What is the maximum number of times an infant's heel may be punctured to collect a blood specimen? 2. 172. Which of the following could cause hemolysis of a specimen obtained by skin puncture? residual alcohol left on the skin. Remember, hemolysis is a breakdown of the red, and alcohol breakdown those things. Okay, 173. Which of the following could cause hemolysis of a specimen collected by the skin puncher? Excessive squeezing of the puncher site to secure the specimen, or residual alcohol left on the skin. 174. Bleeding time procedures are usually ordered pre-surgically. 175. Bleeding times are used to assess which of the following? Platelet function. So it's really how quick the person could clot. And you know, surgery, you cut it into the person. So you gotta know. Okay, 176. Bleeding times are used to assess which of the following? Blood vessel integrity and platelet function. 177. Which of the following can influence the result of a bleeding time test? Circulating von Willebrand's factor. So I guess that's like standing up, sitting down, and standing up right away. Because it fluctuates the fluids. Okay, 178. Which of the following medications will interfere with the bleeding time test result? We all know that's aspirin. 179. Which of the following medication will interfere with the result of the bleeding time test? Not the result, but the test. And the answer is salicylic acid. Salicylic acid. $180. Before starting a bleeding time test, the phlebotomist should ask the patient if he or she has taken any medications. 181. Which of the following procedures is routinely performed on a patient's earlobe? Duke bleeding time, so D-U-K-E bleeding time. Which of the following is used to collect blood following the puncture in a Duke bleeding time procedure? Filter paper. 183. Which of the following compounds is used to prepare the site prior to the puncture in a Duke bleeding time procedure? Alcohol. 184. During a Duke bleeding time procedure, a phlebotomist touches the wound with the collection device. The bleeding time result will be falsely prolonged. $185. If a patient has taken aspirin, how long will it affect the patient's platelet function? 7 to 10 days. 186. If a test procedure can be performed the same way on the same patient and generate almost identical results, the test is said to be reproducible. $187. A test that will detect borderline abnormalities in a patient is said to be sensitive. 188. If a physician wishes to assess a patient's platelet function, which of the following tests will provide the physician with the most reliable results? Modified IV bleeding time. 189. If a physician would like to screen platelet function in a patient, which of the following tests will provide the physician with the most sensitive result. The modified IV bleeding time. 190. Why is the Duke bleeding time procedure not routinely performed in modern medical practice? Lack of standardized puncture. 191. The use of a template and surgical incision as part of a bleeding time procedure was first introduced by Mielke, M-I-E-L-K-E. 191. What equipment should a phlebotomist carry on his or her tray for the IV bleeding time procedure? Bleeding time device, alcohol. 193. What equipment should a phlebotomist carry on his or her tray for an IV bleeding time procedure? Bleeding time device and blood pressure cuff. 194. The question is just like above. So the answer is going to be butterfly bandage and blood pressure cuff. So all of these three questions is the same. What equipment should a phlebotomist carry on his or her tray for an IV bleeding time procedure? A bleeding time device, alcohol, blood pressure cuff, butterfly bandage. 195. The IV bleeding time procedure is routinely performed on patients' forearm. 196. The question is the same. So it's forearm, lateral aspect, volar surface of the forearm. During an IV, during an IV bleeding time procedure, the blood pressure cuff should be positioned above the antecubital crease. During an IV bleeding time procedure, the blood pressure cuff should be inflated to 40 mmHg. 199. During an IV bleeding time procedure, the maximum length of time that may elapse between inflation of the blood pressure cuff and making the incision is no more than a minute. 200. The dimension of the most commonly used bleeding time devices are 1 mm deep times 5 mm wide. Okay, so 201. During an IV bleeding time procedure, the phlebotomist should start the stopwatch simultaneously with the incision. 202. A potential patient complication of the IV bleeding time test is scarring. 203. Two examples of bleeding time devices are Simplate and Surgicoat. 204. Cleaning the bleeding time puncture site too vigorously may cause hyperemia. 205. What effect will increasing blood flow to the bleeding time site have on the results of the procedure? Falls elevated. 206. What effect will dislodging the platelet plug have on bleeding time result? Falsely elevated. 207. During an IV bleeding time procedure, which position of the bleeding time device offers a cosmetic advantage to the patient. Parallel to the antecubical crease. 208. During an IV bleeding time procedure, which position of the bleeding time device is more sensitive to borderline abnormalities? Parallel to the antecubical crease. 209. Prior to making a puncture during a blood collection procedure, antiseptic solution should be applied to the site selected in concentric circles beginning at the puncture site. 210. To examine by touch or feel is to palpate. 211. A return flow of blood from an evacuated tube into a patient's arm during a venipuncture procedure is called reflux. R-E-L-U-X. No, R-E-F-L-U-X. So just picture the person having the flu. Reflux. Not reflex, but reflux. When somebody says somebody reflex is good, I mean they pull away real quick, but reflux, I mean they got impacted. Okay. Okay, 212. Small, non-raised bruises the size of a pinpoint are called petechia. 213. The condition in which the fluid portion of the blood filters into the tissues, decreasing the fluid portion of the blood in the blood vessels, is called hemoconcentration. 214. The liberation of hemoglobin into the plasma following destruction of red blood cell is called hemolysis. 215. What is the medical term for the following symptoms? Dizziness, pallor, sweating, clammy skin, unconsciousness. Syncope. 216. The accumulation of fluid in the tissue is called edema. Under universal precautions, what PPE must the phlebotomist use for every blood collection procedure? Gloves. 218. To prepare a puncture site prior to routine venipuncture, the phlebotomist would use 70% isopropyl alcohol. 219. Which of the following equipment is used for a routine venipuncture? Needle, evacuated tube, and holder. 220. Which of the following equipment is used for site selection and preparation during routine skin puncture? Heel warmer. 212. What is the correct sequence of the following steps in a routine venipuncture procedure? Apply tourniquet, palpate site, release tourniquet. 222. What is the correct sequence of the following steps in a routine venipuncture procedure? Uncap the needle, anchor the vein, insert the needle. 223. During routine venipuncture, the needle should be inserted bevel up. 224. During routine venipuncture, needle should be inserted at which of the following angles? 15 to 30 degrees. Oh, wait. During routine venipuncture, needle should be inserted at which of the following angles relative to the patient's arm? 15 to 30 degrees. 225. During routine venipuncture, how should the needle be positioned relative to the vein selected? Same direction as the vein. 223. During routine venipuncture, how deep should the needle be inserted? Until the phlebotomist feels a slight decrease in resistance. 227. What is the correct sequence of the following steps in a routine venipuncture procedure? Release vein, engage tube, release tourniquet. So once you anchor the vein and you get it, then you let the vein go. Okay, 228. During venipuncture, the tourniquet should be left on a patient's arm no longer than 1 to 2 minutes. 229. A patient has undergone a left radical mastectomy. Which side cannot be used for venipuncture until the patient's physician is consulted? The same arm as the mastectomy, so the left arm. 230. What condition sometimes occurs following mastectomy that becomes a factor in venipuncture site selection? Lymphostasis. 231. The phlebotomist inspects the antecubital fossa of a patient and notes that the area surrounding the puncture site is purple, accompanied by swelling of the puncture site. What is the name of this condition? Hematoma. 232. If a phlebotomist notes a purple swelling around the site selected for venipuncture, he or she should select another site. 233. What condition caused by a hematoma surrounding a venipuncture site may lead to erroneous results? Hemostasis. So remember, hemo is like, and stasis like stay in the blood, stay there, right? Yes. And is a condition. It's a blood state condition. So what condition caused by a hematoma surrounding a venipuncture site may lead to erroneous result? Hemostasis. 234. Swelling caused by an abnormal accumulation of fluid is called edema. 235. If a phlebotomist notes that the arm selected for venipuncture is edematous, he or she should select another side. 236. Which of the following conditions occurring in edematous tissues may alter test result? Injury of fragile tissue. 237. Which of the following veins is often the most accessible in obese patient? Cephalic vein. 238. Veins that are hardened are sclerosed. 239. If a phlebotomist palpates a vein and determines that it is sclerosed, the phlebotomist should draw below the sclerosed area. 240. Which of the following is a cause of sclerosed veins? Numerous venipunctures. 241. If a phlebotomist must collect a blood specimen from a patient's arm that has an IV, the phlebotomist should draw from below the IV. 242. During routine venipuncture, after the phlebotomist engages the evacuated tube, no blood appears in the tube. The phlebotomist determined that the venipuncture attempt was unsuccessful. What should the phlebotomist do first to end the procedure? Untie the tourniquet. 243. During venipuncture, the phlebotomist insert the needle next to the patient's vein on the left side of the patient's vein. No blood appears in the evacuated tube. The phlebotomist should pull back and reinsert the needle to the right.